advocates and our stakeholders. All right, we are live. Welcome to the Public Health and Minority Health Disparities Subcommittee. We have 4 bills on the agenda today. House Bill 354 and Senate Bill 343. This is the Maryland Achieving Better Life Experiences ABLE program. House Bill 703, Senate Bill 584, Public Health Parkinson's Disease. House Bill 1155, that's the work group on establishing a youth co-designed integrated behavioral health model, and Senate Bill 26, the Maryland Medical Assistance Program, Maryland Children's Health Program. So let's go ahead and start with House Bill 354, Senate Bill 343, the Maryland Achieving a Better Life Experience ABLE program. It's the account establishment and procedures. Erin, if you can walk us through the bill.
So the bill conforms Maryland law to Internal Revenue Service regulations governing the ABLE programs by specifying conditions under which Maryland ABLE program accounts may be opened by and distributions made to individuals other than an eligible individual. Under the bill, an ABLE account may be established only for an eligible individual by the eligible individual or a person selected by that individual. If they are unable to establish an ABLE account, the eligible individual's agent under power of attorney may establish the account. If the eligible individual does not have a power of attorney, in priority order, an ABLE account may be opened for that individual by their conservator or legal guardian, spouse, parent, sibling, grandparent, or representative payee appointed by the Social Security Administration. Minors, individuals against whom the eligible individual has obtained a peace or protective order, an individual held civilly or criminally liable for financial exploitation, or an individual who is the subject of a civil or criminal order prohibiting contact with the eligible individual may not establish an ABLE account on behalf of that individual.
Thank you very much. And my understanding is that we need this bill because it's going to conform state law to the federal requirements. Is that correct?
That is accurate, yes.
All right. And I think we have Betty Ann Mobley here from the 529 board. Is that correct? Do you want to speak on this bill?
Yes, if I could share with the committee just some background related to this bill, and thank you all for having us to speak for you today. I'm just going to share with you my testimony. We're asking that this committee vote favorably to pass this bill as written, with the amendment only to change the date of implementation from October 1st, 2023 to June 1st, 2023. This is going to expedite the opportunity for more ABLE eligible individuals throughout the state of Maryland to open ABLE accounts. As was stated by Erin, the programs across the nation are governed by Treasury or IRS regulations, and they define the requirements for managing and operating a qualified ABLE program. Initially, when we launched in 2017, as in other states, when they launched, we operated under draft regulations until November 20th, 2020, when the final regulations were enacted. The preamble to these regulations states that the Treasury Department and IRS recognizes that there may be situations in which an eligible individual with legal capacity may want another person to establish or serve as the person with the signature authority over the ABLE account for them. Therefore, final regulations clarify that an eligible individual with legal capacity may delegate these responsibilities to any other person. Furthermore, the Treasury Department and IRS recognize that expanding categories of individuals who may serve as signatories of a designated beneficiary who lacks legal capacity affords less cumbersome alternatives to a court-appointed guardian in the event the designated beneficiary has no agent under power of attorney or parent to exercise signature authority. We're part of a National Association of State Treasurers and the ABLE State Plan Network, and worked as a group to review and interpret how to operationalize the changes that were set forth in these final regulations. There was a presentation on the consensus of this network at the Treasury Management Training Symposium in June of 2022. Based on that consensus of how these should be implemented and how we should look at those, in August, our program, Maryland ABLE, conducted 9 different focus groups. The purpose of those meetings was to provide transparency regarding this legislation that the program would need to submit to seek input from state. We worked with state leaders, organizations that support people with disabilities, family members of people with disabilities, self-advocacy group, and others with disabilities. Based on the virtual group meetings, we learned that 98% of all participants were in favor of this legislative change. The only recommendations for change that were offered by those groups were to include the provisions for protection of a person with a disability that came directly from the last year's passed supported decision-making statute, Senate Bill 559, which was enacted on 10/1/22. Those requested provisions were included in the bill before you. There were some additional things that Aaron read that I'm not aware of that seem to be part of that. So I haven't seen that final version that you guys are looking at. Currently, there are 46 out of 47 states in the District of Columbia that have fully implemented these final regulations regarding who may open and manage an ABLE account. We in Maryland are the last state to do so. To allow this program to continue to operate as a qualified ABLE program, we must implement the changes as indicated per IRS regulations. House Bill 354 with the requested amended implementation date passed in the Maryland Senate Education, Energy, and Environment Committee with a vote of 45-0 on 2/27/23. And I'd be happy to answer any questions that the committee may have.
Thank you very much, Ms. Mobley. And just to clarify, the amendment you're requesting is that effective date change that would then conform it to the Senate bill that passed unanimously. Is that correct?
As I understand it.
Okay, perfect. Thank you so much. And currently we're the only state that's out of compliance, which is why we need to do this. So let me open it up to the members. Are there questions from the members on this bill? Do I have Robin or Delegate Lewis? Are you raising your hand? Okay, Delegate Lewis, go ahead.
Thank you, Madam Chair. I was having trouble with my screen, but thank you, and thank you, Ms. Mobley, for explaining the need for the bill. I just wanted to make sure, our duty is to protect folks who are vulnerable, and the provisions in the bill I was just looking at make it clear that folks who have a history of confrontation, if they're under if there's been a protective order against them, if they've been charged with financial exploitation, etc., a person that fits those descriptions cannot open an ABLE account on behalf of a disabled person. And so that makes sense to me, but I'm just wondering, in the context of conversations we've had about assisted outpatient treatment and the importance and the concerns about the risk of exploiting the civil rights, the rights to autonomy that vulnerable people have, just want to make sure we're not crossing any funny lines here with this bill. So Ms. Mobley, you could answer, please.
Thank you, Delegate Lewis. Yes, as the Treasury modified who could open an account based on several reasons, one of which is that many people in the disability community don't have involved people in their life, nor have the opportunity and potentially the funds to seek legal guardianships, and many do not need full guardianship. So the expansion of who can help someone to manage this account was designated in this hierarchy for those who, as the regulation states, are unable to manage the account on their own. And the hierarchy is listed, and it says specifically that who can assist is in the order of the hierarchy. So first being a guardian or conservator, because that person who is unable would technically not be able to provide power of attorney consent. The next person on the list is a spouse, then a parent, then a sibling, then a grandparent, and very last, representative payee. And part of the process and part of the discussions that took place prior to us being comfortable with implementing this was what is it that we will do to understand that there is some recognition of anyone higher in the hierarchy? And as all programs determined, that would be through a self-attestation process. The account owner is always the person with the disability. The beneficiary of the money is always the person with the disability in the ABLE program. This person would be signed on merely to help them manage the account as they're putting money in and out, recognizing that for folks with disability who are often underbanked or not banked at all, funds are in short supply. For the most part, this is conserved funds from Social Security benefits or gifts from others to the person. So we're looking to, in every way possible, provide for opportunities for avoiding exploitation and how we can, at the same time, provide an opportunity for these folks who've not been able to open ABLE accounts, who've been constrained by the SSI $2,000 total asset limit since the implementation of this program. So that was the reason for the expansion by the Treasury for who can assist someone. Does that help?
Yeah, it does help. And thank you for your answer. Quick follow on, if I may, Madam Chair.
Yes, go ahead.
If a person with a disability has an ABLE account and has this person there who's helping them to manage the account, they need to make an expenditure from that account. How can they do so? How do they do so? Do they tell the person, write a check for me? They authorize the person to make a transaction that they then review? Like, how does it work in practice?
So ABLE accounts are almost universally linked to the outside bank account for the person. So this is money that the person would already have access to as a person who's working with them. And money is transferred between the ABLE account and the outside linked account. The caveat here is any expense that would be considered a non-qualified disability expense, and qualified disability expenses are only expenses that are for the person with the disability to support them in their health, independence, and quality of life. Those things, they must keep receipts for all of those. And in terms of a regulatory oversight, those would be reviewed if there were a audit by U.S. Treasury on the ABLE account. Many of these people also are people who are currently getting Social Security SSI benefits. SSI also looks at what some of those things are being spent on, because money transferred from ABLE into the outside bank account is not counted against that $2,000 limit for Social Security purposes, as long as it is spent on a qualified disability expense. If it isn't, it counts against that $2,000 asset limit and would be subjected to tax penalties. So there are some provisions within the program for any non-qualified disability expenses. So there's some quasi-oversight in Social Security is looking at the ABLE accounts during redeterminations for Social Security, and there's the opportunity for Treasury oversight during an audit, for which receipts all have to be produced.
Very much. Thank you, Madam Chair.
Thank you. Thank you very much for that clarification and for those questions. I just want to remind the body too that the Maryland Developmental Disabilities Council came in favor of this bill. If you want to learn more, the Maryland, I was just saying that. Thank you. Thank you, Ms. London. The Maryland Developmental Disabilities Council came in support of this bill, and they have actually put information in the chat. Also, as Ms. Mobley mentioned, the IDD community was part of the stakeholders group that was asking for this bill, that was part of the expansion of this legislation. And with that, I will open it up to Delegate Hill, followed by Delegate Chisholm.
Thank you, Madam Chair. I think this question may be for Aaron. And Ms. Mobley, thank you for your explanation. I had some similar questions. On page 2, lines 21, it says the establishment and operation of an ABLE account. And then the rest of the bill, we only talk about the establishment. And it seems to me that the opportunity for exploitation is in the operation of the account. So my question is, why do we explicitly talk about the establishment and operation on page 2, but when we talk about who may not and what the sequence of a hierarchy are, we only talk about opening an account. We don't talk about the hierarchy for who may also operate account, nor do we define in anywhere in the bill that by establishment, we mean both, opening it, we mean establishment and operation. I'm concerned about that separation.
Is that a question for Aaron?
Aaron, yeah,
Oh.
it's for Aaron.
No, I understand your question. I think maybe Ms. Mobley could help, because I believe the procedures for operation are already pretty well laid out under IRS.
But I
I'm
guess,
not sure why the
Right.
terms and operation were added there. Maybe she could.
so if I can follow up, Ms. Mobley, am I correct that opening an account for someone else means putting money in? It's hard to exploit someone when you're putting money in. The exploitation comes when you have access to moving that money around, correct? Which would be operating the account. And all of our language here seems to be talking about who may establish it, meaning who can put money in it, but it doesn't seem to address who can move it around, who can be, I think we're trying to say who can be on the account with the person and have access to it. And I'm not clear that established does that, particularly when we talk about the establishment and operation earlier in the bill. Do you have some idea of, am I wrong about the goal?
No, it is for establishment and operation, recognizing that any actions on the account would be limited to those people who are designated on the account, being the person with the disability and the authority person who's established the account and granted the authority to help manage the account.
So would you consider it unnecessary or more belts over suspenders? That everywhere where we say, like in 29, an ABLE account may be established only for that we, do you think it's unnecessary that we put may be established and operated only for the eligible by the following people, established and operated? I mean, that's really the question, is why we're happy just talking about establishment later in the bill as opposed to established and operated.
I think that by the federal regulations, operation of the account is defined in different parts of the regulations. And so what we were looking to do is change within our law just who may establish and operate,
But we don't say operate later on. We don't talk about who may operate. We only talk about who may establish. That's my question, is whether we're technically writing the bill the way we need to. And I'll just leave it at that. I think Aaron understands. And Aaron, do you think that may be something we can check with somebody about?
I mean, if you were going to do something, I would lean more towards amending out and operation on page 2, line 25, instead of going back into adding that these people could operate the account, because I think then you might be going counter to federal.
So, or can we?
Because there
put a
are very
definition?
clear rules
if
on
we-
how it's operated.
Right, if we take out operation, do we need to reference that when we say establish it, we're not talking about just opening account, we're talking about also operate. I mean, it to me, and maybe I've said it, maybe the rest of the subcommittee doesn't hear it, in which case I'll be quiet, I've raised the issue. I'm not clear that this bill gets at operating the account. And I don't know what the other references in our statute are or with the federal law, but I'm not comfortable that we're doing it. And if somebody can assure me that the language as it is does it.
I'm going to actually open that up to Ms. London, because just a reminder to the members that this bill is necessary because the federal regulations changed. So we needed to change our state regulations to match the federal law. But I understand your concerns, Delegate Hill, because we are sort of walking that line between the federal regulation and the state law to make sure that we're compliant. So Ms. London, do you have an answer for us?
Thank you, Madam Chair. I'm going to try. So the federal ABLE program already kind of lays out who can operate an account for someone. So obviously, first priority would be that the person opens and manages the account for themselves. If they are unable to do that, but they can appoint a power of attorney or an authorized legal representative to be able to do that, that is the priority for them to do as the next step. And there is a process already outlined that the Maryland ABLE program follows in order to get that legal authority. So there are a variety of protections, right? So that's already is a signed form that has to be notarized. You have to send it to the Maryland ABLE program if you, as a person with a disability, are giving someone else the legal authority to help you manage the account. If you can't, you likely have a guardian already who would obviously have the right to manage that, either a full guardianship or someone who's your guardian over your financial assets and things like that. So I think Delegate Hill, the protection in that way in terms of managing already exists both within the federal ABLE law and also the way in Maryland's operations already. And I also believe the other reason, and someone could correct me if I'm wrong, Betty, especially that we wanted this part, that section specifically was important to include both about the establishment and operations, is because it's under the section about the board adopting procedures. And certainly we want the board to continuously to be able to adopt change or whatever is needed to ensure, just like the delegate was saying, that everybody's able to do that, but be protected if someone else needs to assist them with that.
Thank you very much, Ms. London. Delegate Chisholm.
Thank you, Madam Chair. And I understand the bill. I mean, it's a retirement plan, a savings plan, a pension plan, set up so that we're not jeopardizing other benefits against SSI. It's a great plan. My big concern is in the bill, and I don't know if I missed it when you guys talk on page 2, board means the 529 board established under 18-1904. I would like some reassurances that this is a stable board. They're under tremendous scrutiny right now from the comptroller's office, obviously. They're trying to clean it up. We have 4,000 kids in a college or trying to get into college right now or in a college that can't get their money out because of this board. What assurances do we have that this board has been cleaned up, moving in the right direction, and will remain intact? Because the way that I heard Treasurer Davis talking, he was going to take swift and hard action against this board. And where does the board stand at this point if we're going to entrust them with this type of an endeavor?
And Ms. Mobley, I'm gonna let you speak to that, because I know that this is the challenge with this bill is that these are different programs, but we do have this very real concern that is very much on the front of the minds of the members. So if you can speak to Delegate Chisholm's question.
Sure. Thank you for the question. So in crafting this bill, the board is currently in operation and stands as the board over both the Maryland prepaid, the Maryland College Savings Plan, the Maryland Investment Plan, and the Maryland ABLE Plan. The board, as it's constituted, and I just want to make sure everybody is aware, consists of the treasurer, the comptroller, the chancellor of university programs, the secretary for the Department of Education, the secretary for the Department of Disabilities, and other community members appointed by the governor. That is who is on our board. We do present things. This is a very distinctly different program from the college savings programs. We are managed by a different group. In terms of our program management, we have a separate trust. We do present everything to our board, even in terms of being able to come before you and request this change in our legislation based on Maryland law related to competency for people with disabilities. We, as an ABLE program in Maryland, go to many more steps than any other state does. Many states have, by virtue of their laws and regulations, that people with disabilities can have their parents make decisions for them lifelong, whether they are able or not able to make their own decisions. Our regulations, our statutes do not say that. We believe that people have that ability unless determined otherwise. So it required that we come before you for this change. Our board did review this. They did review the results of the focus group meetings. They do monitor us. And when you think about the people who sit on that board, those are people who are looking at that information for us. In terms of looking at potential changes in the future, this law couldn't have been written based on possible changes that may occur in the future. If in fact, the Maryland 529 program, which we are one of those 3 programs, is moved under Treasury, then there would need to be the substitution for the word "the board" to become "the treasurer." I would say to you that even across the country, if ABLE programs are part of Treasury within their state, they still operate under a board. So that's the information I have at this point in time related to the board. Delegate Chisholm.
And I appreciate that, but we're talking about, and when we're talking about the fiduciary duties of a board overseeing this population, it's obviously of paramount importance that it is guarded, and past history looks as though it wasn't guarded very well. And I just, I love the bill. That gives me deep concern. I just wanted to ask, so I appreciate the answer.
Thank you, Delegate Chisholm. Delegate Alston.
Thank you. I was just going to add to Delegate Chisholm's point that right now there is legislation pending to abolish the 529 board and move it completely under the treasurer. So maybe for the purposes of this bill, and it includes ABLE, it's not just the 529 programs, it actually includes ABLE as well, to be moved to the treasurer. So maybe we need to just amend this bill to put it under the treasurer now, regardless of what happens with that other legislation that's tracking, so that there's not the problem.
To be clear, this bill is to get us compliant with federal law. So Aaron, I'm not sure that we could even make that change because it would take us out of, it would continue to keep us out of compliance. ABLE has to be under the 529 program. But I appreciate the concerns. We're probably going to hold this bill. We're not going to vote it today because I understand there are still concerns. But before I call on Delegate Rosenberg, Aaron, can you confirm whether or not I'm correct as to that change? Because it would be quite substantive.
Right. I mean, if we pass this bill and then bring ABLE into compliance with federal law, and then if the other bill passes and everything shifts out of, or if ABLE all shifts to another board, I wouldn't mix the two at this point, because I think the priority would be to bring this program into compliance with federal law.
Thank you. Delegate Rosenberg.
Thank you, Madam Chair. Correct me if I'm wrong, but my sense from this discussion is that the review of how the account is handled is after the fact, or the oversight and review, in terms that it's an audit review. Is that correct? And if so, is it appropriate to have some kind of oversight on an ongoing basis? Is my question. I don't know who the right person is to answer it.
It's probably Ms. Mobley. You look like you were ready to answer. So,
People do not have to ask our permission to use their money to purchase things that support them in health independence and quality of life. That is not part of the regulation. That is not the intent of the program. It is to support people to be able to have access to these accounts and to be able to use these things. The provision for protection is the requirement that receipts be maintained. It would not be possible to operationalize that kind of audit. And in fact, it is not our role as a program to manage how people spend their money. It would be like equating to auditing someone's checking account because of what they're using their money for. It's a very personal thing that they're using their money for. So the program was not established to be an oversight committee for people with disabilities. It was established to provide opportunities for people who've never been able to save beyond $2,000. Just to give you an understanding, in 5 years of operation, Maryland Able has been able to provide a vehicle for over 5,500 Marylanders to save over $61 million in that 5 years. $61 million that for the most part would have been spent on something in our world called spend down. Just money spent in order to not exceed that $2,000 cap. We were able to provide the opportunity for a Marylander to put a down payment on a home and to move next door to her best friend out of state because she now has this opportunity. Ours is not a monitoring role for people with disabilities, but rather a support role by providing a financial program for them to save money and to use money as needed to support themselves.
Thank you.
Thank you.
Thank you very much for that question. We're going to hold this bill. We're going to be meeting again later in the week, but we've got 3 other bills and I want to be conscious of time. However, while we have stakeholders here, is there anyone else who wanted to be heard on this bill today before we move to the next bill? All right, seeing no one, thank you very much. We're going to hold this bill. We will bring it back. Thank you, Ms. Mobley, for being here to answer so many of our questions. And thank you to the members for your thoughtfulness. And thank you, Ms. London, as well, for being here to answer our questions. We're going to move to House Bill 703, Senate Bill 584. This is the Parkinson's Disease Advisory Committee and website. Erin, if you can walk us through the bill.
So I provided a reprint of this bill that is reflective of the bill as it passed the Senate. And then there are a couple additional amendments that are being proposed by Delegate Kerr, who is the sponsor of the House crossfile. You still have possession of the House crossfile. So if you move the Senate bill, both bills could be amended in the same posture. The bill is introduced, created a Parkinson's disease registry. The bill has been amended. If you look through the reprint, some of the provisions in the original bill that remain are on page 3. So the bill is introduced would have required the Parkinson's Disease Advisory Committee to consult with entities that may be able to collect data and work in partnership with the Federal Centers for Disease Control and Prevention to aid the federal CDC in creating a national Parkinson's disease registry. That remains in the bill as introduced. Page 4 on lines 15, the bill required there's an amendment that requires the advisory committee beginning July 1st, 2023 to meet, as it passed the Senate, it was monthly. However, Delegate Kerr's amendment would change those meetings from monthly to quarterly. And then the original provisions in the bill that would have established the Parkinson's disease registry are on pages 4 through 9. That's all been stricken. There is new language on page 9 that requires MDH in collaboration with the state designated health information exchange to establish and maintain a publicly accessible website that has certain information in a downloadable format. The website would include the incidence of Parkinson's disease in the state, and to the extent possible, the incidence of Parkinson's disease disaggregated based on age, gender, sex, race, ethnicity, and cases by county. The website is also required to include the data that's available for the 5-year period ending on September 30th, 2023, and to be updated on or before January 1st of each year to include any new available data. The amendments require that on or before July 1st, 2024, the Parkinson's Disease Registry Advisory Committee will report to Senate Finance and Health HGO on recommendations for a path forward towards the establishment of a fully functional state Parkinson's disease registry. It also requires that MDH will establish the website on or before October 1st, 2023.
Thank you very much. And I don't see Delegate Kerr, but I think Senator Guile, Spencer Dixon from Senator Giles' office is here. Mr. Dixon, do you want to be heard on this bill?
Yes, thank you, Madam Chair and members of the Public Health and Minority Health Disparities Subcommittee. As Delegate Bagnall said, my name is Spencer Dixon, Senator Giles' Legislative Director here. The only other thing I would emphasize is the revised fiscal note now projects that this bill will cost about $105,000 annually over the next 5 years on average, a drastic reduction over the original fiscal note. And we feel that given the prevalence of Parkinson's in the state and the impact it has on our residents, that is a worthy investment to make some progress on this disease. And would just draw your attention to the letters of support from the Michael J. Fox Foundation and MDH, which has come around to support the amended version of this bill with the very minor amendment to change the meetings from monthly to quarterly. Happy to try to answer any questions, but there are members of the foundation here to do so when I cannot. Thank you.
Thank you so much. Delegate Hill.
Real quick, Aaron, just so I'm clear on how we write things. When it says that the meetings occur quarterly as opposed to at least quarterly, does that mean that if they want to have them more often, they can? They cannot? Since, sometimes I see things said at least quarterly. This says quarterly, and
Yeah, you're right. Go ahead, Spencer, did you want to say something?
Nope.
Go ahead.
I'm good.
Okay.
So it limits it, and that's how you all want it. You don't want them to have the flexibility to meet more often if they feel the need to.
No, I think you could.
I was going to say, if that's a recommendation, we have both bills. We have possession.
So
of
I would
both
recommend it, Aaron, if you think it makes a difference to say at least quarterly, I would recommend that the subcommittee take that as an amendment to the amendment.
Let's go ahead and do this. Let's move the amendments. Then we'll have discussion on the additional amendment, because I saw Marie Grant's hand went up and down from the department. So can I have a motion on the amendments?
Move the amendment.
Second.
All right, they've been moved and seconded. All in favor, say aye. Anyone opposed? Go ahead and raise your hand. All right, now can I have a motion on Delegate Hill's amendment to the amendment?
Move my amendment to the amendment.
Second.
All right, let's have discussion. Ms. Grant, did you have something to add to the discussion?
Just wanted to say at least quarterly is fine from the department's perspective. Thank you.
Excellent. And Ms. Pitcher as well.
Was just going to echo the department that we worked very, very closely on this, and we're happy to give them the flexibility on meeting more than quarterly if they need to.
Perfect. Thank you so much. All right. It's been moved and seconded. All in favor, say aye.
Aye.
Anyone opposed, raise your hand. All right. The amendment to the amendment also passes unanimously. Can I have a motion on the bill?
Move the bill.
Second.
All right. It's been moved and seconded. Any discussion? All in favor, say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, both bills, House Bill 703 and Senate Bill 584 pass unanimously. We will amend them to conform together, and we will add the addition of at least so that they have some flexibility in holding those meetings. Thank you, Delegate Hill. That was a great suggestion. We've got about 10 minutes, so we're going to let's go ahead and move to House Bill 1155. We're not voting this today, so let's go ahead and have the discussion now. This is the work group on establishing a youth co-designed integrated behavioral health model. I know we have the department here. Erin, if you can walk us through the bill.
As Delegate Bagnall said, the bill establishes a work group on establishing a youth co-designed integrated behavioral health model that would be staffed by the Behavioral Health Administration. The work group is required to review youth co-designed integrated behavioral health models across the country and internationally, identify successful youth co-designed integrated behavioral health models and the tools, strategies, and funding resources needed to implement similar strategies in Maryland, develop a plan for establishing a sustainable youth advisory committee to play an ongoing role in the development and implementation of a pilot program, and develop a plan for implementing a youth co-designed integrated behavioral health care pilot program that includes a program plan for 3 sites in different geographic areas of the state, uses a co-design model in collaboration with the Youth Advisory Committee, and begins on or before July 1st, 2024.
I just realized I muted. Thank you very much. This was a bill that we heard. We were waiting till after crossover to consider it while we were working on some of the other big commissions that we had. But this was but this appeared to be a really good sort of supplemental effort to the behavioral health system for Maryland bill that we worked on. But was more than a work group. But it would provide data that I think would be really useful in the overall work of the commission. Delegate Hill, you had a hand.
Sure. My understanding also is that the 2022 Joint Chairman's Report required the Governor's Office of Crime Prevention, Youth and Victim Services to look to establish it. So this bill is actually following through on what we were told to do. And so I'd like to move the bill.
All right, the bill has been moved. Do I have a second?
Second.
All right, bill has been moved and seconded. Any discussion? I know there were Delegate Chisholm.
Thank you, Madam Chair. So I'm looking at this, and so on third reading, we took out the whole SNAP part. Is that correct?
That's the next bill, Delegate Chisholm.
Okay, good to talk to you.
Did we want to hear from the department? Or is there anyone want to be heard on this bill before we vote?
I would like to be heard, Delegate Bagnall, if possible. If
All
it's
right,
the wish of the subcommittee.
Ms. Grant, and then Marie Grant, and then Margot Quinlan. Go ahead.
Great. So I think this bill, the challenge with this bill for the department, I think, is we shared in our testimony for the hearing, is not the great purpose and the great policy behind the bill. It becomes a resource question given everything else the department is looking to do in really taking a very holistic look at the behavioral health delivery system in the state across the continent. And so I think we had suggested in our testimony that because there is ongoing work and resources relating to connecting students and youth with behavioral health services, and the Community Health Resources Commission is part of the consortium, that this bill could be or this work could be moved there with the department's participation to make sure it wasn't just school limited. The challenge, I think, for the advocates there and the sponsors, that the work that the CHRC felt comfortable doing was really, again, continuing to study and convene this work. And I know you'll hear from the advocates, and probably have, that they would very much like to move forward with pilot design. So this is a case where I think the department is certainly supportive of the intent, the challenge, and why we can't be fully supportive of the bill as introduced really is a resource question amidst all the other work that we're doing on behavioral health. Understanding, if this bill were not to pass, we would certainly want to take this back and try to move this forward in some other way. So I just wanted to share those thoughts from the department. Thank you.
And we appreciate that. To Delegate Hill's point, this is actually following through on a recommendation. And so I am concerned. I will say I am concerned about this going under the consortium, because again, the consortium's focus is on school-based services. I will just
It wasn't the
keep that
consortium, Madam
context as
Chair,
well.
if I may interrupt. I think she said the Community Health Resources Commission, not the consortium.
Just to clarify, the consortium is under the Community Health Resources Commission, and
My
so,
error, sorry.
yeah, no, it's quite all right. So it would be under the consortium, but within that commission.
No, I appreciate that, Delegate Hill. Margot Quinlan.
Thank you, Chair. Margot Quinlan with the Mental Health Association, and just to sort of piggyback on like this part of the conversation, I first want to say that Marie's been really wonderful and communicative and helpful in talking through the concerns in the department and relaying our feedback back to the department and the CHRC. I think we echo the concern that, with over 85,000 youth who are disconnected from K-12 education in Maryland, putting this under the consortium, which is tasked with the, school-based mental health functions, just really misses the mark. And I think too, the timing of all of the other really big pieces of systems reform, mental health legislation that this committee and the subcommittee have already heard this session, to miss an opportunity to start bringing youth to the table and incorporating youth voice feels like it would be a loss for us. And so, we're certainly eager to work with the department and figure out how this can best look for them, through implementation, but do agree that the, following through on the recommendations of the joint chairman's report from last year, which was drafted, it was jointly with, the Department of Health, BHA, Department of Juvenile Services, and then the Governor's Office for Crime Control, Youth and Victim Services. And so that's where this legislation came from, is just following through on the recommendations of that report. So we're eager to see it move forward and are happy to answer any questions if they arise.
Are there any questions from the members? So we have a motion. It's been seconded. There still seem to be some outstanding concerns between the departments. So I would ask to withdraw the motion, and we'll revisit this bill on Thursday. We're going to have another subcommittee meeting, spoiler alert, on Thursday morning. Delegate Hill, go ahead.
Thank you, Madam Chair. And I just want to know, will we be asking the CHRC to have discussions with MDH and with you all to see if they can come to an agreement about whether it's an appropriate place to shift it or not?
That would be my ask. Yes.
Okay. Thank you very much, Madam Chair.
Thank you. Do I have a motion to withdraw the motion?
So moved.
Second.
All right. All in favor to withdraw the motion to move the bill, say aye. Anyone opposed? Thank you. I just want to make sure that we're procedurally correct, and we will revisit this bill this week. I would strongly encourage the advocates to talk in the next day, come to some consensus, knowing that this is a priority for the committee and a priority for the subcommittee chair. And clearly a priority of the subcommittee as well. So thank you very much for that. And thank you for making sure that we're having those conversations. We have one more bill. So let's talk about it and see if we can get it done. And if not, we'll have another meeting on Thursday. This is Senate Bill 26, the Maryland Medicaid Assistance Program, Maryland Children's Health Program Work Group on Low-Income Utility Assistance. Erin, if you can walk us through.
This bill is the cross-file to House Bill 111. It is identical to House Bill 111, which passed through the subcommittee and Health and Government Operations. The bill requires MDH to establish express lane eligibility program to enroll individuals in Medicaid and CHIP based on eligibility findings by the Supplemental Nutrition Assistance Program. So that piece of the bill is identical to the House crossfile. There is additional language in Senate Bill 26 that requires the existing work group on low-income utility assistance to submit a final report on its study findings and recommendations, including recommended legislation and regulatory changes to Senate Finance and House Economic Matters Committee. So this is a work group that already exists. There's an amended, there's a language in the cross file of House Bill 111 that just extends the work of this work group and extends their submission of a final report.
Move the amendment.
Do I have a second?
Second.
All right, it's been moved and seconded. Any discussion on the amendment? All in favor, say aye. Anyone opposed, go ahead and raise your hand in the chat. All right, do we have a motion on the
Move
bill?
the bill as amended.
Second.
All right, it's been moved and seconded. Any discussion? All in favor, say aye. Anyone opposed, go ahead and raise your hand. Delegate Chisholm. Delegate Riley. Delegate Hutchinson. All right, the bill passes not unanimously. Thank you. That is everything for today. And it is just now noon, so we are going to make sure that we are getting you all to lunch before bill hearings. Don't forget, we have hearings at 1 p.m. Thank you very much for your hard work, and look, check your emails. We will have another subcommittee on Thursday morning. I'll bring donuts again. And thank you very much. With that, can I have a motion to adjourn?
So moved.
Second.
All right, thanks. It's been moved.